and welcome to VLCC Femina Miss India 2020, co-powered by Sephora and Reposo. I'm Supreet Bedi, your host for the day, bringing you another expert opinion that hopefully you shall be smiling about. Now, it's said that you should use your smile to change the world. But I'm wondering if you should change your smile for the world. That is the hot topic of discussion today with our expert, Dr. Dheeraj Sethia from the Dental Roots. Now, with over 2 decades of experience in dentistry and having treated over 15,000 clients, all eminent personalities, famous celebrities, politicians, well, they're here to give you your dream smiles with all the modern technology and a team of expert doctors. So let's rope in our doctor, because my aim is to make sure that all your questions are answered. And our smiles are ready. So let's rope in our expert of the day. Hello, doctor. Good to have you with us.
Hi, how are you doing?
I'm very well. How are you?
Fine, thank you. You have a beautiful smile.
Oh, thank you. I was just kind of taking that compliment in for myself. So thank you for reiterating that. I will take that graciously. But we often tell people to keep smiling. And more than often it's the case where they're conscious of that smile. So how do they keep smiling? What is the importance of a beautiful smile?
For me, smile is a passion. For me, smile is an attitude. For me, when I work on a patient and get a beautiful smile, I feel very happy. For self-esteem, it's very important to have a beautiful smile. Smile is an attitude. You know, for smile is like everything for me.
Right. So some people have that attitude. Like you said, some people have that passion, and some you have to really work upon getting them there. So therefore, the term smile makeovers that we hear about every day. But what does it really mean? What is that makeover about?
Smile makeover, you know, it can be a small treatment like enameloplasty, where you just use a small burr to define the teeth. You can make the teeth more shorter or more rounded so that they look cute on the face. Sometimes elongated tooth, you can shorten it up. So like sometimes patient has a gummy smile. So with a small gum contouring, you can make the teeth looks more beautiful. The smile looks more beautiful. Sometimes you have to go for a teeth whitening. And in some cases, we recommend a patient a dental veneers. In some patients, we recommend our patients to go for Invisalign, which is a clear aligners. And you can close the gaps in the front teeth. You can align your teeth without showing the braces.
Oh, that's all interesting, because it wasn't the case before. When I was growing up and I heard about people fixing anything, braces was the only answer. So I believe now we've got modern technology doing a lot more.
Yeah. Now you don't have to worry at all. You can smile. You can date with the aligners on.
Oh, that's amazing.
Yeah.
What kind of duration we're looking at for these things?
It depends upon the malalignment, but minimum 6 months to 9 months. And in case you are closing the front 2 teeth gaps, then you can do it in 3 months. It's very quick.
Okay, so is that something that you've got to keep as like nighttime activity as well, like how people used to?
Yeah.
So do you have to continue doing that?
Yeah, ideally you should wear it for 21 hours in a day, ideally. But in case you're wearing only in the night, then your time period increases. If you're finishing the treatment in 3 months, 6 months, it might extend to 4 months to 7 months. In case you wear only in the night, yes, you can wear over the night also. I have a patient. She said, I wear only in the night. I said, that's too less. Kerry, no, my sleep is 17 hours. I said, then it's okay. So if they sleep from 10 to 4 in the evening next day, so then it's okay. It's a 17 hours they're using it. Then it's okay.
All right. So it's about whatever commitment they can give to that fixing.
Yeah. Only while eating, you have to take. Sorry.
While eating, you take it off.
Yeah.
There's one thing that's associated with any kind of dental work, which is the inconvenience or so-called pain that goes with it. So the only procedure that we ever know, which our people talk about, our families talk about, is the root canal. And everybody says, oh my God, I've got to go to the dentist for that. And I remember when I was in school, there used to be a poem called, I think it was called, This is Going to Hurt Just a Little Bit. And it was by Ogden Nash. Right.
Yeah.
And it used to talk about roadworks in your mouth. That's how it compared the work of dentistry. And somehow we've been conditioned to think that any work that involves dentistry or dental work is pretty much painful. So is that a myth, or is there really inconvenience attached to any dental work you do?
Nowadays, I can say it's a myth, because nowadays dentistry is a painless. Anesthesia, starting from anesthesia, it become a painless procedure. While doing a root canal, with the special instrument, rotary instruments, the treatment become in less than 45 minutes, you can finish the root canal.
Oh,
And that's why, and become atraumatic now, atraumatic. The latest technology where you know where the canal is, you can go for a Cbct, that a CT scan for one single tooth. And dentists know that this particular tooth has how many canals and where the location of the canal is. It's become so easy that, the dentist knows that this is the spot where he has to drill. This is the spot where he's going to encounter the canals, and he knows the length also of the root. So it become very, very easy, and it become a cakewalk now for a dentist as well as for a patient. In case they go for CBCT and they go for a good treatment plans.
Well, that's amazing to know how advanced technology has come. Right. Let's talk about veneers, because you mentioned them. So I want to understand, for the sake of our viewers, what does veneer mean, and how it's different from? I think it's about those crown implants that people also talk about. So if you could just differentiate between the two for us.
Okay, veneer is a type of a prosthetic restoration. It's a porcelain material in which a dentist has to do a very minimum preparation of the tooth, and you can glue the veneer on patient's teeth, and you can do the smile makeover. You can close the gaps. You can align the teeth with the help of veneers. You can change the color of patients. Patient can get the desired results in single sitting. When we talk about, it's amazing, and results are so good that patients are very, very happy with the veneers. And the biggest advantage with veneers are, it's like no preparation required on the tooth structure. It's very minimum. It's very, very, very minimum preparation required. And with the advancement in the bond, which helps to glue the veneers to the tooth structure, we get a very good strength of the veneers, and it become a part of your tooth structure. And then you can maintain the veneer as a normal tooth structure. You can brush, you can floss, you can eat. Only thing which you should avoid, something which is very hard, you should avoid. Otherwise, everything as normal as we do it. That's what veneer is. When we talk about the crown part, crown is the you need a more tooth structure grinding. It covers the whole tooth structure. Crowns are recommended on the molar, that's a back tooth of the jaw, and veneers are recommended till your premolars and on your jaw. So that's the difference between a veneer and a crown. And crown needs more. Crown needs more reduction, and veneer needs reduction. That's what is required.
So, sorry, Doc, are you there? It's freezing at my end for you. Are you there? Can you hear me? Yeah. Okay. So, in like a layman term, am I okay to think that when you say that you work on the tooth, it's like filing, like how we file our nails? So you kind of just give it that kind of prep work before you put some kind of a mask or a cap on top. Is that a layman understanding?
Yeah. As you go for a artificial nails, what they do, They
Yeah.
just glue it on your nails, right?
Yes, yes.
Yeah, the same thing. They roughen the nails and they put it glue, and they bond your
Yes.
artificial nail. It's almost the same. So you don't grind too much. You do a roughen of the tooth structure, and you take the impression and you put the veneer on. That's it. That's what is required. In our practice, what we do is we do a temporary veneer to patient first, so that patient
Okay.
can see and patient can take home the veneers, patient can use the veneers, patient can take selfie, patient can discuss with the family members, patient can show to everyone. Once they're happy, that's we call it test drive for a veneer, you know. So once they're happy, they can come back and they can say, okay, this is what I really like. Sometimes we give few different veneers also, so that patient can check the color also. One, you know, how it looks on the patient's face. That's what we do.
This chat is a true eye opener, or if I can say a mouth opener, because I didn't know half of this stuff that you're talking about. And I consider myself, equipped with this kind of knowledge. But you're actually telling me a lot more that is new for me as well. I didn't know that you could do a test drive on a veneer. So that's, of course,
Yeah, you can.
knowledge for
You
me as well.
can. You know, I have a patient who came. She said, "Doctor, I need a Huda smile." I said, she's shown me the picture, her picture to me. She said, this is the what kind of smile I like. So now with the DSD, that's called digital smile designing, you can design the smile. You can pick the teeth. You can choose what color you want to pick. And you can take the right texture from one patient. You can put on that patient. You can see how they're going to look like. And you can print the smile for them. It's like, it's become so advanced now and so easy. Earlier, it used to take a lot of time. It used to take a lot of efforts, but now it's with digitalization in dentistry. It's very good. It's like amazing to work now.
It's like teeth customization has gone to another level. It's
That's
as
what I'm
good as styling
saying.
yourself.
Yeah, you can choose. You know, I have one patient. He came with a Rishi Kapoor's photograph. I said, "What is this?" She said, "You know, I really like his sharp canine and his long canine. I really like this canine. Can I have the same canine?" I said, "I'll try. Okay, I don't want to duplicate the smile of Rishi Kapoor ji, but I'll definitely try to, get you what looks nice on your face." And patient nowadays wants what they really want to get it done. So we are here to help them out.
Designing smiles, like you said, that's obviously
Yeah.
making sense now to me. What about a smaller procedure like teeth whitening? So when you talk about something like that, is it applicable to everyone, or do you have to see how much their enamel can take?
I normally don't recommend for very young kids, less than they are 9 and 10. But after 12, once the pulp is a sensitive part of your tooth. Once you have a thickness of enamel is there, once the pulp is properly formed, which is normally formed at the age of 10, then we normally don't say there is no problem by using a good bleaching system. In our practice, we use Zoom Whitening, which is most advanced system and doesn't give any problem to patients. There are few patients who complains of sensitivity, but that can be manageable with desensitizer toothpaste. So that's it's hard. We in our practice we do a lot of whitening and highly recommended for my patients.
Mm-hmm. And what about home whitening kits? What is your view on that? Do they really work?
A home whitening kit, in case you have a customized tray for yourself, then home whitening kits really works. In case you buy off shelf, you don't have a proper tray to wear it. So the solution which you wear it on your teeth, they normally want to fall out of the trays because the trays are not customized.
Okay.
But if you go to a dentist and ask for a bleaching trays, so that is a customized tray for you, and then you can buy an off-shelf bleaching solutions. and you can use it at night, or you can use it for in the daytime also for 4 to 5 hours. If you're going for a movie, you can just place it and just watch a movie. That's what you can do, and you can get that the perfect smile.
Amazing. We've got Sakshi here, doctor, asking, I have slightly lifted teeth, and doctors avoid to put on braces as it is. Oh no, so she doesn't have enough lift in her teeth is what she's saying, and doctors avoid to put on braces as it is not so lifted. How can I get it flat? Does that question make sense to you?
I think she wants to say that she has a flat teeth and she wants to take it little in the front. That's what she wants to do it, or she has a proclined teeth and she wants to get it flattened.
I think that's your guess is as good as mine. I think what she is, because she's asking how can I get it flat, so I'm guessing that is her concern.
Okay, yeah. So what I'll suggest her, she can go for a veneers and she can go for a aligners, which are transparent braces. Sakshi, if you can, you're listening to us, you can go for aligners, you can go for a veneers, which can help you in case you don't want to go for braces right now. They are both of the very good methods to get your teeth aligned and get your teeth flattened out.
All right. I hope, Sakshi, that helps you. I have another question from Ahuja, who's asking, how long is the procedure for CBCT? You mentioned something like that, didn't you?
Yeah, CBCT is a type of X-ray where you just take 5 minutes, less than 5 minutes. So you get a report, and it helps you for a doctor and for a patient to diagnose how the canals are being placed, how many canals are there, it has an infection at which canal, and what is the length of the root. So it helps in doing a right diagnosis for a patient. So CBCT is such a CT scan for that particular tooth. I hope Dr. Mr. Ahuja.
Right, Dr. Ashu is asking now, how many sittings are required for implants?
Nowadays implants are single sitting job. So in case you come, you go for implant. In case your bone is good, you can go for even a temporary crown. And nowadays, the temporary crown you can prefabricate before you place the implant. It's like you're designing your crown before you're placing the implant. Earlier, it used to be you place implant, you wait for 3 months, you call the patient again, you take the impressions. Nowadays, it's like if you have to go for implant, you can go digitally. You can make a hole, and you can place the implant, and you can put temporary crowns immediately on the same visit. And for final visit, you have to come back from 3 months to 6 months for the final crown.
Right. I hope, Ashu, that answers your question. Radha wants to know what's the minimum investment one is looking at for veneers. Is that per tooth? Is that how it's
Yeah. It is per tooth. Radha, if I'm taking the right name, Radha, 12,000 rupees is the minimum cost per veneer what a good ceramist or a good dentist are going to charge you. And it can goes up to 15, 17, 18,000 rupees per veneer.
Right, that gives you a price estimate. I also have another question here. I have uneven lips for my upper teeth, because of which my smile looks lopsided. So one side, the gums are more visible than the other side. So obviously it's no symmetry there. So how do you work at that? Can that be corrected using dentistry is what we've been asked.
Yeah. You can correct the, this is called gum contouring. So in case one side gums are more visible, with the help of dental lasers, you can contour your gums. You can mark your gum which are look more prominent, and we can contour your gums to the same size of the other side. And you can have a perfect smile with the perfect contours. And lasers are atraumatic, painless procedure, single sitting. And in some cases, I don't have to give even anesthesia. So it's painless. Just with the help of gel, you can just finish the procedure.
Great. It's amazing what lasers are doing these days. Dentistry mein bhi pahunch gaye. Very, very cool to know. Anamika wants to know, will braces change my face structure?
Unfortunately, no. The face structure cannot be changed with the help of braces. But yeah, your only braces works on only on the teeth, not on your facial jawbones.
We also have
But
another
you,
question.
yeah,
Sorry, carry on.
please.
Carry on,
But
carry on.
but you can do a camouflage. Sometimes patient has a, we call it class 3, where the lower jaw is in front and upper jaw at the back. Yes, you can do a camouflage also, but normally doesn't work on the jawbones.
Do you have to shave off the crown for crown implants?
I think it's not a right question to be asked. It's like, do the for crown, do you have to grind? Yes, you have to give a shape to the tooth structure, because if you don't give a shape to a tooth structure, crown not going to fit nicely. It's going to look more bulky. Aesthetically, it's not going to look very pleasing. So yes, it requires a crown shaping is required.
Another viewer, the beautiful soul, is asking us, what's the importance of having proper teeth alignment?
Importance of beautiful smile for me, it gives you a lot of confidence. If you have a beautiful right smile, it is like a for me it's more like a, I feel more confident from inside if I have a beautiful smile. So that's what my answer is.
Ishika wants to know any home remedies for dental care.
Home remedies, yeah, you can massage your gums at home. You can do warm slime gargles, which will help you to have a firm gums. You can use a Clorox mouthwash, which is also a very good way to have a good uh, gums, and that is what is required at home. You can use a air floss, which is a highly recommended nowadays, air floss.
So do you is that easy to procure? Air floss?
Hello?
Can you hear me, doctor?
Yeah. Now it's now.
Yes.
Yeah, I can hear you.
Is it
So
easy to
the last
procure?
thing what you can, yeah, air floss is available online. You can just put air floss or water jet or oral irrigation device, and just pick good company, and you can good to use it then. It's a very good thing. Highly recommended. Go for air floss. Ishta.
So this is of course better than your previous traditional flossing style of actually taking a ribbon or a tape and going between your teeth.
Uh, when you do air floss, it massage your gums also. It
Okay.
and when you do a floss, sometimes you try to pull your teeth. Sometimes you try to take the food particle out. In that, sometimes you dislodge your veneers, sometimes you dislodge your crowns. So instead of using a floss, sometimes I recommend my patient to you go for a air floss than a normal floss.
All right. Okay. Malaika wants to know, should I go for teeth bonding for brighter teeth? Is that a term?
Yeah, that's she wants to go for a tooth bonding is like a yeah, she can go for a tooth bonding. Tooth bonding is a composite filling material instead of putting a ceramic or porcelain veneer. So you can go for a tooth bonding filling also. The only disadvantage with composite or bonded fillings are if they get over the time they get discolored, and they have chances to have a small cracks, and which is going to be visible in future. So my recommendations, in case it's only one tooth small chipping, you can go for a composite. There's no problem. But in case you're looking for a complete smile makeover, veneers are much better option than a composite.
Ishika also wants to know, what's the best way of getting food particles out of your teeth? That's the common problem she has.
So the best thing is to water prick. I told you is the best way to take the food particle out. And second best is you can use a floss. You can carry a floss along with you, and wherever you feel you have to use it, just use it. That floss. Floss is the way.
Right. Amin also has a question that takes you back to veneers. She's saying she's been told that the shaving that's required to put a veneer on is actually bad for us in the long run. So is that a myth as well?
Yeah.
Could you hear me?
So
Sorry, doc, have I lost?
if I heard rightly, you said, can you just repeat your question again,
Yes, of
please?
course, of
Yeah,
course.
yeah, yeah.
So,
You lost in between.
okay, so Amin wants to know, she's been told this, that the shaving that's required before a veneer comes on, that is bad for us in the long run. So is that a myth as well?
No, you just require a zero point 0.3 to 0.5 mm of shaving, which is like very, very minimum, very, very minimum. And nowadays there are veneers which you can do a no prep veneers. So they recommend a they are very thin. They are very thin. They can you can make the veneers in 0.1 mm also. So it's very safe. You can go ahead with veneers. Take my recommendations. Just whoever's your dentist, tell him to do a very minimum prep and go ahead with your veneers.
Right. Shireen Anwar has a question as well. Without going for a RCT, can we opt for prosthodontic treatment?
No, you have to go for root. In case you are in pain and there is pain which is radiating to your ear, head, and it's a pulsating kind of pain, then you have to go for root canal, and you cannot just bypass root canal. Cannot just go for only for prosthetic treatment. In case she's not in discomfort, it's just a prosthetic. There's some crown she requires just to correct the smile. Then she can bypass the root canal. She can just go directly for the crown. But in case she's in pain, discomfort, swelling, referring pain, for a root canal first, and then crown in prosthetic part.
Got it. Right. Sakshi wants to know, could you please elaborate on cosmetic dentistry? What does it really mean?
Cosmetic dentistry means from simple cleaning and polishing, that is air polishing nowadays, air polishing, goes to whitening, goes for veneers. It includes bonded fillings. It includes going for laminates, composite laminates. It means that you have to go for aligners. That's a transparent braces. So it's very vast. So a lot of things comes under this cosmetic dentistry now. A lot of things like gum contouring. If you have a black gums, you can, if you want a pink gums, so that also comes under cosmetic. If you have a sharp canines, if you don't like your sharp canine, if you have a gaps in the front teeth, that also comes under cosmetic dentistry. If you want lip fillers, if you look for Botox, that also nowadays comes into cosmetic dentistry. So it's a vast line now.
Right. Ria wanted to know about cavities. She said she's got loads of them. How does one tackle those?
Ria, you have to visit a dentist who can quickly fix. Nowadays, there's atraumatic fillings also, where you don't have to grind, or if you have to grind, you have to grind very minimum. And dentists can just fix it with atraumatic fillings. So they are called ART fillings. So you ask your dentist, he can really fix the job.
Right. Gurleen wants to know about the gap between teeth. How does one fix that?
Gurleen, in case the gap is very minimum, then it can be fixed with laminates or veneers. In case the gap is too wide, then aligners or braces will help you to close the gaps. Sorry, I'm answering fast because I have to cover up.
Yes, that's fine. We're still on the same topic, but my choice is saying, is there another way of closing the long gap between teeth without braces? Because he had braces before and it did not work. In fact, after removing them, the gap started to appear. So is braces still the solution only?
No, she can go for a crown. She can go for a veneers. In case the gap is too much, then also she can go. She might have to consider 4 veneers, so that when we do 4 veneers, you can take some space from the front teeth. You can close the gaps by taking 4 or 6 veneers. You can close the gap in case she doesn't want to go for braces or aligners. She can go for crowns also, and we can close the gap.
Annie is saying my teeth are slightly crooked. I don't know which direction to take.
Uh, Hi, Annie. This is in case you have a teeth crooked, then the right way is to go for, you can go for aligners. That's the right way. Or in case the teeth are less crooked, you can go for a small procedure like enameloplasty, which can round it off your sharp teeth, or you can go for a veneers, which can block your crooked teeth, and which will give you appearance that you have a straight teeth.
Right. Also, something very simple that every day we have a problem with is plaque. So lots of people saying, how do you de-stain the teeth because they've got marks on inside of the teeth? So I'm guessing that's plaque, right? But
That's
your
yeah, that's a wonderful question. You know, you should start using a small bristles. You can start using a rotary brush, because if you use a round brush and you can go inside your teeth and you can brush properly. Normally, when we do brushing, we normally focus only on the front side. We don't see the inside tooth. And if we start using a rotary brush, which has a round bristle, you can start using from inside also, and it will remove all your stains from inside.
my teeth are turning to black. I'm guessing that stains as well, right?
Yeah.
But they're saying it looks like teeth decaying. So should I fill it or should I clean my teeth and keep a clip upon it?
First, you have to go for a cleaning in case it's just a stain, it'll come out. But in case with normal cleaning it doesn't come out, then dentist can take an X-ray and see why it is not coming. It's because of decay. Then in case it's decay, then the best option is to do the filling.
Right. Anjali wants to know, can we undo an unsatisfactory dental bridge and restore the smile with other methods?
Wow, yes, Anjali, you can revisit your dentist in case you're not happy, and you can remove your old bridge and get it refix your with the new bridge. In fact, you can change your color also. You can change the shape also in case you don't not liking the shape of your old bridge. You can tell them to change your bridge for sure.
Aishwarya has a cute question. She's saying, or admitting it rather, that she's got Dracula-like teeth protruding from her gums. So is that something that can be fixed as well?
Yeah, she can go for a small procedure that's we call as a rounding of the sharp canines or sharp teeth. It's a it's a very small 10-minute procedure where wherever you have a sharp teeth, which is more prominent on the face, you can mark and you can round it off that teeth.
We have a 16-year-old here asking if it's too early to do any kind of dental work.
Dear, you are 16 years is not too early. I think you should visit a dentist.
In the same breath, we've also been asked, I'm in my 30s, is it still okay to get dental work done to correct your teeth?
Yeah, yeah. And age is no barrier. Recently, we had treated a lady, which she's 85-year-old. At the age of 85, she wants to get a dental Swarovski done. That's a dental jewelry on the teeth. So I was just laughing. I said, why you want to go for a dental jewelry on the teeth? She said, you know, it's a marriage in the family, so I want to have a bright smile. So I thought, let me fix this dental jewelry on my face. I said, wow. So age is no barrier now. So you can choose, you can from.
We also have a question here saying, hang on, are you there?
Yeah.
Yes, you're there. All right. I have to do RCT. Are there any side effects I should be aware of?
RCT, you don't have any side effects. You can go for RCT. There should not be any problem to you.
Ishika also wants to know, does brushing your teeth immediately after food damage the enamel?
No, it doesn't damage your enamels, because in case you are using a hard brush or you're using a brush for very long, definitely it wears the enamel off. But in case you're using your brush softly and gently and using a medium or a soft brush, it doesn't harm your enamel at all.
So the next question is pretty much answered. What brushes do you recommend? Hard, soft, or medium?
I think medium and soft is recommended to patient. Patient who has a enamel wearing, then I recommend a soft. Otherwise, medium is good enough.
All right. Lots of questions still coming for you. How can one take precautions to avoid teeth problems? Shreya wants to know.
Shreya, the first important step is you should visit a dentist on a regular basis. That's the first recommendation from my end to you. Second is brushing twice is the minimum what you should do. Third, using a air floss. Fourth, you should ask for your dentist about a good gum paint. You should ask your a dentist a good mouthwash and start using it, and that's what you should do.
Also, Dr. Till, more questions come our way. Let's just quickly talk about COVID and dentistry, really. How did the dental roots team take care of this time? That was quite stressful for everyone.
Yeah, when we started our practice in the month of April, we closed for hardly for 1 week to 10 days. And when we started our practice after 1 week, the first thing we follow the WHO guidelines. And in our practice, before the patient entered to the practice, the temperature, the oxygen levels, that first thing has been monitored for each and every, even the doctors coming to the practice. The first thing is at the entrance, they will be checked. Gloves, mask, head caps, shoe covers are mandatory for doctor as well as for our patients. In our practice, we don't calling a lot of patient at one time. We want to segregate patient in our 2 floors, depending upon the, in case it's an old pay patient, we like to call them early in the morning as a first appointments. On every patient, we are making sure that we are cleaning our dental chair, sterilizing the dental chairs, sterilizing the chamber with the help of UV light and a foggers. And when patients are going out, we give them a paper which says about what to do when they reach home, that they have to change their clothes, they have to take a bath. So that's what we follow in our practice. And doctors are using nowadays the respirators or a double mask when they're using any treatment which requires say water. Then in our practice we are using a respirator which covers and which blocks the your face.
That's obviously the new normal now, isn't it?
Yeah. When I wore the respirator in the month of April, people used to make fun and say, "Doctor, what are you wearing? How are you going to breathe from it?" But now I think everyone is used to in my practice with the respirator on.
We all have to change our ways given the pandemic. So as long as we can change with it, I suppose that's the style. Shagun here wants to know, silver filling in the molars and premolars can stay for how long?
The beauty part of the silver filling, they stay for lifelong. They're not going to come out. The only problem with them is all silver filling, because it's metal, it's contract and expand with cold and hot. So whenever it expand and contract, it leads to a fracture in the tooth on a long term. It leads to micro leakage for long term, but they last the longest. So you don't have to worry about the longevity of the silver filling.
And precautions for teeth sensitivity, please.
Precautions for teeth sensitivity. Okay, the precautions means you should not, first of all, in case you should start using a Sensodyne or Thermoseal toothpaste or any sensitive toothpaste. You can pick it up from the market and start using it. And in case some patient has a habit of grinding the teeth in the night, that also increase that sensitivity. Sometimes patient has a habit of brushing for long or brushing with a hard brush, that they should avoid. Sometimes I have a few patients who has a habit of chewing ice. So they said that, we enjoy chewing ice. So that also leads to crack in the tooth. So anything which is which can damage the enamel, we should all avoid. Some patient has an acidity problem. So that is the few points which I can tell you right away.
And can sensitivity be reversed?
Yeah. Sensitivity can be reversed. In case it's a minor sensitivity, it can be reversed with a normal bonding, what we use in our normal fillings, with just for bonding, no fillings, there's a bonding. In case uh, it's in case there's enamel wearing, then you should go for a bonding with fillings. In case it's a deep uh, cavity, then you can go for a liner and a filling. In case it's very deep, it's touch your nerve, it's a continuous sensitivity, then the only option is to go for root canal.
All
So,
right. And someone's actually asked, how long does a root canal last?
in case it's done properly, it lasts you forever. Root canal should not give you any problem.
So the people who've actually done 3 or 4 root canals, that means that the initial procedure wasn't right, and that needs fixing.
Yeah, in case they had got on the same tooth, they got 3 to 4 times, that means the dentist is either missing some canals, and that's missed canals are giving a problem, or
Okay.
they're not cleaning the canals properly, so that the problem is happening again and again.
All right. Dimple wants to know, what is the reason for double teeth sometimes?
Double teeth is, sometimes double teeth happens because it's an anomaly. So sometimes you have a 2 teeth in from one tooth bud. So it's very rare, but yes, it's an anomaly.
Right. Another question here. After removing my braces, my teeth, although they've been aligned, the smile looks kind of triangular, which means the side teeth are too inside and kind of ugly. Can it be corrected again?
Yeah, it can be corrected again with the help of veneers. You can correct your smile, and I think so. You were not so regular with our orthodontist. So if you would be more regular with your orthodontist, the problem will be much lesser.
I can't stop grinding. What do I do?
You should wear we wear a night guard, so you can wear a night guard, and you can use the same night guard in the daytime. What I normally recommend to a patient is to increase the fluid intake. Take a lot of water during the daytime. So when you take a lot of water during the daytime, your stress level reduces down. And in the night, you should take hot water with honey. That's what my recommendation is.
Is chewing gum harmful for teeth?
Chewing gum is not harmful for teeth, but it's harmful for your joints because you're using the pressure. Whenever you chew your gums continuously, it gives a pressure to your joints. So it's not very harmful for your teeth, but it's definitely harmful for joints.
Jasdeep wants to know, what if I don't want fillings? Will increase of vitamin C in my diet help strengthen my gums?
It can strengthen your gums, but in case you already have a decay, the filling is the only answer. You cannot have a vitamin C. I wish I can give vitamin C to my patient.
Is it okay to remove wisdom tooth on upper jaw if broken by decay?
Yes, it's very safe to remove a wisdom tooth if it is broken. It's a broken tooth. It's an extra tooth. If it is a decayed, it's carious. If it is a fractured tooth or broken tooth, it will leads to food accumulation, and which leads to more decay on our joining tooth. So it's better to take it out.
We also have a question from Beniwal. He's asking, normal silver filling or silver filling by ultraviolet, which is best for deep cavity?
Silver filling with ultraviolet is no term. Normal silver filling is the right answer for it. There is nothing you can do with ultraviolet light and silver filling. Maybe he wants to know about either a silver filling or a composite filling with UV light.
Okay,
so
maybe that's the question. Yes.
Yeah, maybe that's the question. So I feel in case composite is the choice. Silver filling has a mercury in it, so it's not really recommended. And in case we can avoid silver fillings, and we can go ahead with the normal tooth colored filling with ultraviolet is the right thing.
Is it okay to have slight spaces in between teeth? So is that normal? Is that what you see for normal teeth alignment?
In case it's a self-cleansing. In case there is a food lodgement happens, and it can be self-cleansed, and the food lodgement doesn't stay there, then it's normal. There's no problem. But in some patients, food lodgement remains between the two teeth, and that leads to decay between both the sides, both the teeth, wherever the food lodgement happens. So in that case, it has to be restored.
Right. How does one decrease upper teeth pain, and why does it happen?
Any pain happens because of the two reasons, either because of gums or because of the tooth decay. In case it's because of gums, you should we should suggest you for cleaning or a deep cleaning. In case it's because of your cavity, it has to be fixed with a filling or the next treatment plan.
Rebecca wants to know, can headaches happen because of tooth problems as well? Are they interrelated?
Yeah, they are interrelated because whenever there is a infection that's a pus, that it always give a patient a headache. And whenever there is a increase in your blood pressure, when you lie down, there's an increase in blood pressure. So moment you lie down, there's a pulpal pressure also increases. And that also leads to throbbing pain in your head. It's a sign for that you have an infection in your tooth. In case you have a pain in the tooth and pain on your head on the same side, that's a sign of infection.
So it's not a normal case of just popping a paracetamol. You need to really look at what's wrong.
Yeah. In case you have a pain in the tooth, as well as you have a pain on the head on the same side, yes, then you should visit a dentist. You should not take that as a painkiller.
Another question from Jasdeep. I have an extra premolar on the lower jaw and my wisdom tooth is erupting, but it has no space in the jaw. So it's pushing my other teeth. What can I do here?
In case it's troubling you, in this case, then the wisdom tooth extraction is the right option. Don't worry about your extra tooth. Let the extra tooth to be there. Your wisdom tooth is troubling you. You should focus on wisdom tooth right now.
My front tooth has broken. Charming says, what is the best thing to do, crown or filler?
In case it's a small fracture, then filling will work. In case it's a big fracture, then crown will be better. Crown or a veneer will be a better option.
I suppose, Doctor, these questions will keep coming. They all want your wisdom, really. So I'm wondering, do you want to just leave them with a generic oral hygiene, what to do for that beautiful smile, sort of a message from you before you go?
What I want to tell you, all the listeners, is that they should visit a dentist on a regular basis. They should do brushing twice daily. They should use a hair floss or a floss. They should use a mouthwash. Gum massage is one thing which will increase the blood circulation. At least once in a week, they should do a warm saline gargles. Any lukewarm saline gargles will increase the blood circulation. So that is my recommendation to my patients. And healthy smile is a confident smile, and confident smile boosts your confidence.
All right. Thank you very much for bringing all these wonderful tips to our viewers. I do hope that all of you are going to take this on board because oral hygiene is very, very important. And you've heard the talk, DSD it is, design your own smile. It's so easy now. I'm amazed at how customization has just taken over this world of dentistry.
Thank you so much, Supreet. It was very good to be here with you and had a lovely session. Looking forward to have another session with you.
And like I always say, and it makes more sense today, keep smiling, people. You really changed the world doing just that. So thank you all for joining us. And thank you, Doctor, for everything you brought to us today in your information. So
good luck, Supreet. Same here. Take care. Bye.
You too. Bye.
Bye.